and how it is going to help the patient and causes less stress on the whole of the health system. What are the types of autologous blood transfusion? What are the advantages of autologous blood transfusion? What is a leapfrog technique? This is a very interesting topic. Normovolemic hemodilution, intra and post-op blood salvaging, application of intra and post-op blood salvaging techniques. So, what are the types and what are the advantages? Leapfrog technique, we will discuss that shortly in next few. So, definition: autologous means patient's own blood. So, administration of patient's own blood collected pre-operatively, during surgery or after surgery. It does not always have to be before the operation. It can be collected during operation and after the operation. There are huge advantages of autologous transfusion. Number one is basically avoidance of allergic reactions, hemolytic and immunosuppressive reactions. Patient having rare blood group can have autologous blood transfused, and the blood is always fresh without cross match. You do not need to cross match that blood. You do not need to check the blood for hepatitis or HIV, or for that matter COVID-19 or any other disease. So, types of autologous transfusion: pre-op, acute normovolemic hemodilution, intra and post-op blood salvage. These are the important factors you need to consider before you think of autologous transfusion. Health condition of the patient, volume of blood required for surgery, time available and urgency of surgery. So important factors needs to be considered. And what practically happens? Patient donate 1 unit of blood per week for 4 weeks. So you can collect 4 units of patient blood if you want to. What do you have to do to the patient? Patient just needs some iron supplements. Otherwise, a healthy patient can give up to 4 weeks of 4 units of blood for consecutive 4 weeks. Another very important factor you have to consider is the time interval between the last donation and surgery. Last donation means the patient himself or herself donated the blood, and the surgery should be more than 72 hours. So the time interval between the last donation by the patient and operation should be more than 72 hours. Leapfrog technique. I have actually never seen practically this thing happening, but it is practically possible. This is what the frogs are leaping upon each other. So what you do on day 0, you take unit A out of the patient and save. Call the patient on day 7 and you withdraw unit B and C, and unit A is transfused back to the patient. Day 14, patient came back again, unit D and E are withdrawn and unit B is retransfused. This is the unit B which has been retransfused. You call the patient on day 21, unit F and G are withdrawn and unit C is retransfused. Now, what have we got at the end? You have got unit D, E, F, and G available to you for the patient. So you have collected 4 units in a 4 weeks time period, and this is patient's own blood. And according to the research, a young, healthy, or otherwise healthy patient do not get any serious troubles or problems because of this leapfrog technique. So the only thing is that we have to apply this technique to collect blood, and the patient is willing to follow the instructions. And what is acute normovolemic hemodilution? Sorry. The removal of blood from the patient immediately before or just after the induction of anesthesia and its replacement with fluid. So, while the patient is being anesthetized, you can remove the blood of the patient and save it, and when the operation starts, you can transfuse the patient, or when the bleeding starts, you can transfuse the same patient with his or her own blood. So this is called acute normovolemic hemodilution. This is another type of autologous transfusion. So this collected blood can be stored at a room temperature for up to 4 hours or at 1 to 6 degrees Celsius for up to 20. A few words about post-operative anemia. A surgeon knows what he or she has done to the patient. So if the patient develops moderate to severe post-operative anemia, the surgeon knows that something has happened during the surgery which is causing the post-operative anemia, or the patient is continuously losing blood from somewhere even after the surgery. So this patient is developing severe. So the consequences of peroperative blood loss and the surgeon must exclude concealed bleeding while finishing the surgery. He or she should check the concealed bleeding points and make sure that there is no internal bleeding anywhere at the site or inside the operation site. What are blood? A simple machine which can warm the blood. Blood is stored in a refrigerator at a temperature which is very low compared to the human body temperature. So they are kept between 2 degree to 6 degrees Celsius, while the human body temperature is 36.5 to 37.5 degrees Celsius. So we have to warm the bags to bring this temperature to this temperature. This is just a simple blood warmer. There are hundreds of types of machines and they are not very expensive. And I keep on asking the hospital authorities to arrange for these warmers. But unfortunately, due to a lot of bureaucratic problems, we do not get these blood warmers in most of the hospitals. So we come a long way from RBC, development of RBC, production of RBC, special features of RBC, and pre-operative anemia, per-operative blood loss, post-operative blood and loss and anemia. And what is the way forward? Way forward is that we should have artificial RBCs or synthetic RBCs. So we can eliminate, number one is the desperate need of human blood, and number two, we can eliminate the chances of transmission of diseases to the people through the transfused blood. Number three, we can eliminate complication of the transfused blood. So people are struggling hard to find a way out of this. Biosynthetic artificial red cell is on the way. So the red cell concentrate, which is synthetically made, is going to be available maybe in 3 to 5 years time, which will eventually reduce, if not eliminate, all the problems of blood transfusion.